I'll do my best, Bill. It is my pleasure, Mr. Speaker, Mr. Vice Speaker, counselors, friends and guests, to give the annual CEO report to the Council. Welcome to DC. We have a three-ring circus coming to town soon. I have no financial disclosures, but I really must disclose that I'm incredibly proud to lead a dedicated ACR staff in support of our leadership, the board, council, steering committee, council, and all of our members to move forward to reach this vision that was part of the strategic plan that reads, the ACR members are universally, and I highlighted that, acknowledged as leaders in the delivery and advancement of quality health care. Notice it doesn't say radiological care, because we really do intend to be team-based healthcare players. The objectives over just my 15 minutes here to highlight a couple of the ACR activities. It would be impossible to do them all. Many of these are included in the courses that you'll see in the agenda for the educational program. And again, I really would strongly suggest for those that conflict with the council actions to use the virtual program. And I want to discuss a rising tide accountability across healthcare, and then describe the ACR membership drive to ask all of your help. Now, we really had quite a year, so I do think that we have a great time to pitch ACR membership as being critically important. If you look at the SGR repeal, the coverage for lung cancer screening, we discussed the multiple procedure payment reduction from 25 to 5%, protecting access to mammography for our female patients so they can start at age 40 without risk of out-of-pocket expense. Increased funding for the NIH and BIB, which really is, I think, a really important thing for the future of the specialty. And then, of course, clinical decision support use is expanding rapidly. We've got our advocacy and economics highlights, and again, these are identified by all of you in our member surveys as the two most important portions of what you expect the college to be providing. I'm not going to steal from the Economics Forum. They've got a great program for you, and all of you really should attend, but I do have to say that they are really remarkable efforts. But understand that those efforts are successful because they're built on other portions of the college. The research that provided the National Lung Screening Trial, therefore lung cancer screening coverage, the MPPR, based on the articles that Bibbs already cited for you, and mammography screening value. It really involves all segments of the college, and it's a prolonged and persistent effort that gets us these successes that we described. And our relations with patient advocacy groups are critically important, with our external relationships being a major goal of the strategic plan. So these alone represent a significant membership value. If you're talking with one of your partners who's not a member, use these as a membership value proposition for the ACR. But there's really a whole lot more going on in addition to those things. We have really great relationships with other radiologic organizations. We meet regularly, most recently with the Rankin Ray Society out in Los Angeles. Those relationships are really in fabulous shape. We've got increased recognition at major medical associations. The American Medical Association, our delegation headed by Van Moore, couldn't be in better shape and has great respect there. The Council of Medical Specialty Societies, some of you may not be familiar with, but the 44 member organizations of that group represent almost 800,000 physicians in this country, and we have great workings with them. Most recently, 2 weeks ago, had the opportunity to present computer decision or clinical decision support to that group. And then the National Academy of Medicine, and I'll talk about some specific things that occurred. We addressed, I think, with you last year that we were able to participate as a sponsor to the Improving Diagnosis in Healthcare project done by what was then called the IOM, and is now the National Academy of Medicine. Dr. Allen got to present before that group, and we had 2 submissions of recommendations that ought to be considered. And in the final almost over 300-page report, which I would recommend all of you to review the executive summary that came out in September 2015, it really was a great result for radiology. That improving diagnosis in healthcare, they specifically mentioned that they recommend consultation with radiologists and pathologists early in a healthcare episode in order to optimize diagnosis. Were specifically recommended in that IOM report. And this is just a sample of the goals that they set. To facilitate more effective treatment, they had collaboration among pathologists, radiologists, and other diagnosticians specifically mentioned. Another mention where they even went so far as to say, create current procedural terminology, that is CPT codes, and provide coverage, including time spent by pathologists and radiologists advising the ordering clinicians. Now, we're not sure where these recommendations will go, but to have an opportunity to get in front of this kind of body and have them support the value of what we do is just terrific. Now, we have another opportunity now with the National Academy of Medicine, and that is we've become a sponsor and participant in the National Cancer Policy Forum, which allows us to participate in the discussion of where cancer research is going forward and what should be discussed. And of course, as you all know, with the Cancer Moonshot program, with Vice President Biden at the helm of that, we expect that to be very high profile. Hedy Hrychak is going to be our member representative, and Ella Kazaruni, soon after our sponsorship, was actually named to participate in the program on implementation of lung cancer screening that the IOM or NAM is going to be putting out in June this year. We also got to participate in what's something called the Interagency Working Group on Medical Imaging. Now, we actually got a chance to present to this group. It was formed within the executive branch based on the Medical Imaging Research Initiative that was put into legislation supported by ourselves through the Academy of Radiology Research. It's co-chaired by the chair of NIBIB, that is Rod Pettigrew. And again, we got the opportunity with the organizations, RSNA, the Academy of Radiology Research, and the International Society of Radiology to advise that group. Some additional highlights I want to go through as far as things going on in the college. And Bibb mentioned RSCAN. This really is a fabulous opportunity for all of you to go into your communities and get the opportunity to teach your referring physicians about computer decision support, as well as to emphasize the importance of the choosing wisely criteria on which it's built. The RSCAN project was funded by CMS in the Transforming Clinical Practice Initiative over the next 5 years. And we need to get the enrollment levels reached in order to continue that support for those 5 years. So right now we're at 618 of the anticipated 1,000 radiologists recruited in the first year and 3,656 referring physicians. So please, if your practice or department is not enrolled in RSCAN, please visit the booth here and get yourselves enrolled. It's a really easy process to get involved, and the staff will help you through that. Some other recent highlights. There was a great program done by Mark Willis down at Baylor as far as educating medical students on the optimal use of imaging through computer decision support. Our Board of Chancellors saw this as a real opportunity to support and has put it in the so-called measured growth opportunity, and that's going to go forward. But in addition, they applied for an R&E grant through the RSNA and have been funded at $150,000 to instruct more medical students and expand their program out to 20 different sites. All of this is built on an information technology platform that the college developed, the so-called Radiology Content Management System. Medical students, we've identified that obviously with the match results a year ago, we don't want to get back in that situation where we have many, many unmatched slots. We have to raise the belief in medical students that we have an exciting and prosperous specialty to go into. So we held a job fair following the AUR that was co-sponsored with the Society of Education Radiology Educators and the APDR. And my thanks to Alex Norbash at UCSD who hosted this, and we had a terrific turnout of about 70 medical students. But the main thing is we're going to use this as a template so that you in your state chapters or in your academic institutions can sponsor these types of things locally in order to let medical students know who we are. Now, getting back to the medical students and residents, and I had to insert these last night. I drove the people crazy putting in changes and slides to the last minute. But I have to say with the projections that Dr. Emanuel made that I really think that the residents and fellows who are in the room, there is great data out there to show that you're going to have an awful lot to do. You're going to be very, very busy people, and the job opportunities, I think, will be plentiful. This article in Health Affairs projected the utilization services of various specialties. You can see here that radiology was actually the 4th highest specialty as far as anticipated need of services in 2025. But with all due respect to Dr. Emanuel, I think he was way off base there. I wanted to highlight a couple things in the research office run out of Philadelphia, the IDEAS project, that is Dementia Imaging, anticipating enrolling 18,000 enrollees in order to study the PET imaging for dementia. IROC, our quality control initiative, goes forward very strong. We have an application in for a TMIST. You all remember DMIST, the tomosynthesis trial application, and we're very encouraged by the fact that the NCI asked that we expand the numbers up to 140,000 women for that trial. It's not yet approved, but we have very high hopes. The college continues to support, of course, the cooperative groups ECOG Akron and Energy, and we had a signing actually last week of a very new industry trial with RTOGF, and you saw Dr. Curran, who received our gold medal last evening. There's lots of opportunity, I think, and then we've actually done a real research project with Etta Pisano, surveying members, particularly in the academic world around the country. We really have to make sure they know who we are and what the college offers them as far as capabilities. Bibb talked a bit about the Health Policy Institute. This year in 14 scientific papers, the ICE-T app, if you've not gotten a chance to look at that on the web, take the time because it really does give you the imaging component of all DRGs and allows you, if you're in discussions with bundle payments, to go and make sure you stake claim to your appropriate portion of the payment and argue that you're participating in making sure that care is efficient and therefore any savings gets distributed partially to radiology as well. And the update of the Neiman Almanac, which I think really was a very useful tool. In my compliments to the folks from Hawaii that really got in a head-to-head battle, including the legislative proposal in their state, battling an RBM that was really putting the clamps on their referring population. Again, I'd like to highlight, Bibb mentioned the Advanced Radiology Services Challenge, and please go by the Foundation booth and the HPI booth in order to, so we can meet that challenge and qualify for that additional funding. A few education highlights. The Education Center, during the so-called Snowzilla storm, the 25 inches of snow that hit Washington during one of our breast imaging courses, they were actually able to pull the course off with 80% of the attendees getting in, despite the fact that it had to be held in the Westin rather than our Education Center. But we also have growth in the international market. We've worked with the people from RANSR, the Royal Australian New Zealand College of Radiology, did a so-called taste tester at their annual meeting last year, and now have 2 courses going on there that will actually be a revenue stream to the college because of the recognized unique quality of the Education Center. Any of you who haven't attended there for a course, I highly recommend it. We also have GE is sponsoring our so-called breast imaging boot camp in Saudi Arabia coming up next year as another opportunity. And then we've signed a memorandum of understanding with the program director in radiology to use the RCMS, the Radiology Content Management System, to develop an end-of-rotation exam. And we hope to have this in place by 2018, but we think it'll be a great assist in addition to the Dixit exam in order to allow them to assess residents' performance and progress through training. The Radiology Leadership Institute, I just wanted to highlight one thing here, 26%, and the residents and fellows, my compliments to you, 26% of our RLI enrollees are now members in training. We're refashioning a program to help them reach the milestones that they need to do in training, and as I say, I think that's just going to be a tremendous program as well. And all of these programs that I'm highlighting are in line with the strategic plan and program assessment process that we've outlined to you in the last 2 meetings. That is to say, any of these programs that come through, we now have an operational principle for our staff that no program goes ahead without going through the actual program assessment. So you can rest assured that we're being proper stewards of dues dollars. Now I'm going to switch gears a little bit. This was a challenge that was put forward by Tom Lee and Cosgrove in the Harvard Business Review that says, despite wondrous advances in medicine technology, healthcare regularly fails at the fundamental job of any business to reliably deliver what a customer wants. This was really at the core of what Dave Kushner was telling us in his presidential address, and we've got to step out and be part of that solution. Bibb has pointed out that we're going to be accountable. We have to accept and embrace the accountability because it's going to be the single most important factor in all of, not just radiology care delivery, but all of healthcare delivery in the next decade. We've seen the triple aim. I'm sure you've seen this in many publications and presentations of better health for the population, better care for individuals, and lower cost through improvements. But the public continues to be bombarded with this type of information. Very recently, this is the May 4th edition of USA Today, where they're now claiming that 251,000 deaths are due to medical error. That's why we're going to have to be accountable. There is no escaping the fact that the public is going to hold us accountable for the care we deliver. And to fix the system really will require complete transformation, as Dave so wisely pointed out, to a system centered around the patient and not centered around physicians. This accountability wave is upon us. So though many folks, and I asked this question at the Council of Medical Specialty Society meetings. I said to all the CEOs in the room, how many of you feel that more than 50% of your members understand that in 8 months, data is going to be collected that's going to influence their reimbursement in 2019? And not one CEO could raise his or her hand. The bottom line is we really have an awful lot to do as far as educating our members, and you can be a force to go out there, be champions in your practices and departments to make sure everybody understands what Bib just described to you as far as the impact of macro with MIPS and APMs. Likewise, in that group, virtually every CEO said right now they're concentrating on getting their people ready to prepare or to comply with MIPS, feeling that the APM goals are really just too high. But we've been preparing for decades for this. We've got what used to be called standards, became guidelines, now practice parameters. We've got the quality promotion with our accreditation program, including DICO, the Diagnostic Imaging Center of Excellence, that's really growing rapidly. And again, a program I think if you're not involved, you really ought to look into for your practice and department. We've got the appropriateness criteria, of course, now distributed through ACR Select, and the incredible infrastructure that we've been able to develop over the last several decades to support these things, and now supported all of that focused on the patient-centered care as per our new commission, and the Imaging 3.0 that remains the infrastructure there to carry it all. I'm not going to spend time on this because Bib has already discussed our qualification as the Qualified Clinical Data Registry, but realizes that this really makes that eligible professionals can meet the PQRS or now the MIPS reporting standard by participating in these QCDRs. The college now has 3 years approved for that, and they can assist you. So our core purpose in the strategic plan, as Bib said, empowers members to advance the science, empowering members to advance the science, practice, and professions of radiological care, but we need to attract all the potential and eligible members out there. I've put this up before, and I hope you'll take it and spout it to any of your either partners that aren't members, anybody who can honestly say they're not $19 a week better off based on those things that the college has done on their behalf, honestly shouldn't be members. So join us in this campaign to raise our membership by as we lead and change together. I wanted to say a personal thanks to Bib Allen. It's been my pleasure as CEO now for 2 years. I came into this job about 2 weeks before Bib took over this position, and he's just done a fabulous job. It's been a pleasure to work with. So thanks to you for all of your attention, and remember, the door is always open. Thanks very much.